Hey everyone, we are prevention specialists by nature as a dental hygienist, and in this episode, we're going to be talking about caries risk and what we do to help our patients understand caries, the development of decay, what the culprits are, and the balance between risk factors and preventive factors, and how you can help your patients really reduce their caries risk and take a preventive approach to future decay issues that your patient has. We'll talk all about remineralization and demineralization and really just give a broad overview of the impact you can have with a preventive mindset to help your patient really stabilize their dentition if you have a patient that presents in your chair with a high caries risk. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Hey, are you in dental hygiene school or just got your acceptance letter and just started dental hygiene school and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out. Dental caries is an infectious and communicable disease. Cariology includes the cause, process, and management of decay. This is like our wheelhouse, guys. It also includes the science and prevention of dental caries. And this is an area that you need to become an expert in. We are the prevention specialists that really help our patients manage dental caries. So let's talk about drill and fill surgical model. The drill and fill surgical model eliminates decay, but doesn't really treat the bacteria that's in the mouth that actually caused the decay in the first place. It's like fixing your rot on your house without removing the problem that caused the rot in the first place. Maybe the water splashes up on the house, causes the siding to rot. So you replace the siding, but you didn't put a gutter on the house to redirect the water. Guess what? The siding's going to rot again. The same holds true in our drill and fill surgical model. We're not actually addressing the causes of the decay. We are eliminating the decay by drilling and filling, but we're not addressing the causes of the decay. So, caries stabilization and prevention model determines the patient's risk level and then provides interventions to either reduce or eliminate the risk factors that have caused the dental decay. Now, there's two groups of bacteria that are responsible for caries in the dentitions. You have Streptococcus mutans and Lactobacilli. The Streptococcus mutans are found in large numbers within the dental plaque. The Lactobacilli are found in patients who have a diet high in sugar. Now, let's talk about the caries process. It's caused by a variety of factors, and we know this, but they must all be present at the same time. So the great parts all have to come together. You have to have a specific bacteria, a diet rich in fermentable carbohydrates, and a susceptible tooth. All of these things must be evident in order for dental caries to develop. And there are different stages of caries development that you need to understand. So there's this balance of caries progression of remineralization and demineralization. So think about this. Demineralization happens when the calcium and the phosphate dissolve from the hydroxyapatite crystals. Remineralization happens when the calcium and the phosphate are redeposited in previously demineralized regions. How cool is that? So you have these risk factors like xerostomia, home care, and nutrition. And then you have these protective factors like sealants, adequate home care, fluoride, good nutrition, and a reduced sugary diet. So think about that balance between those two in caries development. There are two distinct stages of caries development. You have an incipient lesion, where the caries begin the process of the demineralization of the enamel. Now, an overt or frank lesion is characterized by cavitation, and this is the development of a hole or cavity. So, when we're talking about caries development, the tooth is attacked by the acid that's in the saliva and biofilm. Both the calcium and the phosphorus dissolves from the enamel. That's what we call demineralization. And remember, I said the fluoride and the phosphate and the calcium help to remineralize the enamel. Now, there is secondary decay as well. So remember, I told you the drill and fill model, the surgical model, where they restore by doing cavitation and placing a restoration. You can get secondary decay if you don't address the causative factors that created the decay in the first place. Secondary decay, also known as recurrent decay. The margins where the restorations meet the tooth structure can harbor bacteria. This can cause the recurrent decay. The earliest detection of recurrent decay can be seen on radiographs. It's important for you to know that biofilm uses the food that we eat in order to break down the starches and simple sugars into acid. Now, the acid and the saliva combine with the food debris to form additional biofilm, which then causes an increase in the acid production from the biofilm. This causes the biofilm to become more toxic and more virulent. It creates an environment where all of those things can come together, right? You have to have the susceptible tooth and the time, along with that acid exposure and biofilm with the high sugar content. Our patients experience rampant decay based on some of the other caries development risk factors like xerostomia, reduced home care habits, or poor nutrition. So remember, I want you to think about that as a balance between demineralization and remineralization. And your job as a prevention specialist is to tip the balance by increasing the protective factors and decreasing the risk factors. Those disease indicators with new restorations and white spots and enamel lesions let us know that our patient is out of balance and that their risk factors have gone up. We need to increase the protective factors in order to reduce the risk factors and bring our patients' caries risk down to a manageable level. So it's important as a preventive specialist working with our patients to fight off decay that we are working to increase those protective factors with our patient so that we can balance out the remineralization process. And this is why in school you learn so much about all of the preventive strategies. From your very first class, you learn about preventive strategies that you can use to support your patient's efforts in order to keep those protective factors up and the risk factors down on that caries development balance beam. It's important for our patients to have lots of tools in their toolkit, and different patients have different requirements based on their risk factors. You might have someone who doesn't have xerostomia, but they have poor home care, or maybe they have dexterity issues. Their balance is going to be different for their protective factors than someone else who has nutrition balanced, but they have xerostomia. So you need to understand the preventive strategies that you need to implement with each individual patient that you treat. There are some patients who don't use fluoride. What kind of preventive strategies are you going to help those patients use or implement in order to promote the remineralization process in their mouth without using fluoride? There is a vast amount of tools in our toolkit that we can use to reduce the pathogens that cause decay. Remember, I said strep mutans and lactobacilli. To buffer the pH, we want to have a pH that's around neutral, at least 5.5 or above. We know that that's when the caries process is initiated. So when we think about that balance point for our patient, we need to think about what preventive strategies work for each one of the unique patient situations that we encounter, looking at each patient's risk factor and balance in a unique and individualized way, and then thinking about how we can align our patient's needs with what we have for information, what we have for resources for them. What types of adequate home care recommendations are we going to make for our patient so that we can provide them their best chance of keeping that balance, that harmonious balance in their mouth, so that they can reduce or eliminate their caries risk? They can get things under control. We do a caries risk assessment as part of our assessment process. So it's really important for us to share that information with our patient, explain to our patient the balance between demineralization and remineralization in the mouth, and how their preventive factors and risk factors impact that balance between those two things. Enamel is really, really cool. And the fact that we can remineralize enamel is pretty profound. So use that information to your advantage. Help your patient understand the environment to which the enamel is being exposed and what they can do to control that environment. What knowledge does your patient need to have or understanding to motivate them? Remember, we've talked a lot about health beliefs and how to change a behavior with our patient, but you have to understand, how does our specific patient need us to inform them in order for them to make informed decisions about their specific needs as far as the caries development process goes. I personally love povidone iodine to reduce the strep mutans contained in the biofilm and really balance out the patient. I also love some of the other products that are on the market that buffer the pH, the xylitol bringing the pH back up, and the MI paste. There's all these different tools in your toolbox for different things for your patient. So you need to find out, is it a nutritional thing? Are they a frequent eater? Are they somebody that are constantly exposing their mouth to an acidic environment? Maybe they need to brush better or longer or more often. Maybe they're just a swisher and you need them to brush. Maybe they're a person who is constantly sucking on lifesavers. So think about all the different scenarios for your patient and then what those scenarios and behaviors do to impact that balance between the risk factors and the protective factors, the preventive factors that you can help your patient understand. Best of luck to all of you with that. And this is totally in your wheelhouse. You guys are the prevention specialists. And prevention is where we need to focus our attention, increasing the knowledge and understanding of our patients so that they can understand how caries disease process works, and also, more importantly, what they can do about it, other than just waiting to put a filling in there. Think about the impact you can have. So speaking of decay, this is something that's going to be on your board exam, so I figured I would just stick it in this episode for you guys, is GV Black's classification. So if you have a pit and fissure restoration or decay area that needs restoration, that is a class 1. If you are on the proximals of the posterior teeth, that's a class 2. If you're on the proximals of anterior teeth without involving the incisal edges, that's a class 3. If you're on the proximals of the anterior teeth and it does include the incisal edges, That is a class 4. And if you have decay or restoration in the cervical third of the tooth, that's a class 5. A class 6 restoration only includes the incisal edge of the anteriors or the cusp tips of the posteriors. Picture like putting a filling on a wear facet on the posterior tooth. Those are your classifications, GB Black's classifications for restorative needs and caries. So if you have a class 3 carious lesion, it would be proximals of the anterior teeth without the incisal edge, or if you had a class 3 restoration, it would be a composite restoration that's part of the proximal area on an anterior tooth without the incisal edge. Hopefully that helps you with GV Black's classification. I know that information is on your boards, and lots of your test questions while you're in hygiene school include GV Black's classification. So hopefully that helps. I thought this was a good place to add it. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested, or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much.